Hi, friends, welcome to my YouTube channel Nursing Classes, a place where you get nursing competitive exam MCQ and theory classes. आज की इस वीडियो क्लास में हम एम्स नागपुर नर्सिंग ऑफिसर एग्जाम 2020 का क्वेश्चन सॉल्व करने जा रहे हैं। शुरू करने से पहले अगर आप लोगों ने मेरी YouTube चैनल को सब्सक्राइब नहीं किया है तो सब्सक्राइब करें और बेल आइकॉन को क्लिक करें जिससे मेरे आने वाली वीडियोस का नोटिफिकेशन पहले मिलेगा। अगर वीडियो अच्छी लगी तो एक लाइक कर देना और अपने दोस्तों के साथ शेयर करना। चलो अब शुरू करते हैं। 51. The visceral pleura is A. The membrane lining surface of the lungs. B. The membrane lining the wall of the thoracic cavity. C. The thinnest portion of the peritoneum. D. The fluid around the lungs. Correct answer A. The membrane lining surface of the lungs. 52. Which of the following techniques are examples of non-therapeutic communication? A. Giving advice. B. Focusing. C. Restating. D. Paraphrasing. Correct answer A. Giving advice. 53. Major approaches in problem solving are A. Inductive, deductive, active, analytic. B. Inductive, deductive, purposive, synthetic. C. Inductive, deductive, initiative, synthetic. D. Inductive, deductive, analytic, synthetic. Correct answer D. Inductive, deductive, analytic, synthetic. 54. Acute illness refers to an illness that A. Is longer than 6 months and can also affect functioning in any dimension. B. Is synonymous with disease. C. Has a short duration and is severe. D. Causes an irreversible condition. Correct answer C. Has a short duration and is severe. 55. Intrinsic factor of Castle is secreted by A. Parietal cells. B. Mucous cells. C. B cells. D. Chief cells. Correct answer C. Parietal cells. 56. Which mode of clinical application for qualitative research is considered to be the sharing of qualitative findings with the patient? A. Coaching. B. Empathy. C. Anticipatory guidance. D. Assessment of progress. Correct answer C. Anticipatory guidance. 57. An order for prednisolone reads 10 mg 4 times a day. The dose for the child is 2 mg. How many pounds does the child weigh? A. 36 pounds. B. 44 pounds. C. 40 pounds. D. 46 pounds. Correct answer B. 44 pounds. 58. Thiamine has been prescribed for an alcoholic patient. The rationale for administration of this medication is the prevention of A. Huntington's disease. B. Alcoholic dementia. C. Alcohol withdrawal syndrome. D. Wernicke-Korsakoff syndrome. Correct answer D. Wernicke-Korsakoff syndrome. 59. Which is the most relevant knowledge about oxygen administration to a client with COPD? A. Oxygen is administered best using a non-rebreather mask. B. Blood gases are monitored using a pulse oximeter. C. Hypoxia stimulates the central chemoreceptors I the medulla that makes the client breath. D. Oxygen at 1 to 2 L is given to maintain the hypoxic stimulus for breathing. Correct answer D. Oxygen at 1 to 2 L is given to maintain the hypoxic stimulus for breathing. SAT. Which of the following statement is not applicable to using a evidence base in nursing practice? A. To ensure the best quality of care given to patients. B. To ensure that nursing decisions are based on the best quality of evidence. C. The use of research evidence in nursing practice does not need to be evaluated after it is used or implemented. D. Evidence used in nursing practice must be appraised for its validity and applicability. Correct answer C. The use of research evidence in nursing practice does not need to be evaluated after it is used or implemented. Exert. Assessing the laboratory findings. Which results would the nurse most likely expect to find in a client with chronic renal failure? A. Decreased serum calcium, blood pH 7.2, potassium 6.5 mg/L. B. 135 to 40 mg per deciliter, potassium 3.5 mg/L, phosphorus 7.35, decreased serum calcium. C. 115 mg per deciliter, increased serum calcium, creatinine 1.0 mg per deciliter. D. 110 to 30 mg per deciliter, creatinine 0.5 to 1.5 mg per deciliter. Correct answer A. Decreased serum calcium, blood pH 7.2, potassium 6.5 mg/L. Bassett. Which of the following help prevent water loss through skin? A. Melanin. B. Carotene. C. Keratin. D. Collagen. Correct answer C. Keratin. Tirsat. The situation in which individuals have excessive worry or belief that they are suffering from a physical illness despite lack of medical evidence is known as A. Dissociative disorder. B. Pain disorder. C. Somatoform disorder. D. Freiberg disorder. Correct answer C. Somatoform disorder. Chaussat. Sunken fontanelle is a sign of A. Turner syndrome. B. Hydrocephalus. C. Down syndrome. D. Dehydration. Correct answer D. Dehydration. PESAT. Elements of primary healthcare are the following except A. Health education. B. Intersectoral coordination. C. Provision of essential drugs. D. Cost effectiveness. Correct answer D. Cost effectiveness. Chiasat. Disposal of expired and cytotoxic drugs as by A. Autoclaving. B. Municipal waste. C. Chemical treatment. D. Separate landfill disposal. Correct answer D. Separate landfill disposal. Sursat. The ability of a person to readily recover from stressful situations is called A. Mental freedom. B. Androgyny. C. Resilience. D. Hardiness. Correct answer C. Resilience. Arsat. A method in which several rounds of questions are given to a panel of experts is called A. Q-sort methodology. B. Content analysis. C. Delphi technique. D. Meta-analysis. Correct answer C. Delphi technique. 69. Which of the following is a differentiating test between mucus and cerebrospinal fluid, CSF, from a nasal discharge? A. Specific gravity. B. Protein. C. Microorganism. D. Glucose. Correct answer D. Glucose. 70. The nurse is informed that a client with a large surgical incision is being transferred from the intensive care unit to the surgical unit. What medication does the nurse anticipate the physician will order for this client? A. Ascorbic acid. B. Vitamin A. C. Vitamin B12 complex. D. Mephyton. Correct answer A. Ascorbic acid. 71. Before the placenta functions, the corpus luteum is the primary source of synthesis of which of the following hormones? A. T4 and TSH. B. Estrogen and progesterone. C. Cortisol and thyroxine. D. LH and FSH. Correct answer B. Estrogen and progesterone. 72. The following develops as a result of a nurse's experience in a specific clinical area, the time the nurse has been in practice, and the quality of relationships the nurse has formed with clients. A. Knowing clients. B. Leadership. C. Personal ethics. D. Ability to delegate care. Correct answer A. Knowing clients. 73. Which of the following is most appropriate intervention to reduce stress in a preterm infant at 32-week gestation? A. An attitude of extension when prone or side-lying. B. Sensory stimulation including several senses at a time. C. Kangaroo care. D. Tactile stimulation until signs of overstimulation develop. Correct answer C. Kangaroo care. 74. Which type of leadership theories consider people inherit certain qualities that make them better suited to leadership? A. Contingency theories. B. Trait theories. C. Situational theories. D. Behavioral theories. Correct answer C. Situational theories. 75. Oligohydramnios is related which of the following condition? A. Renal agenesis. B. Esophageal atresia. C. Anencephaly. D. Down syndrome. Correct answer A. Renal agenesis. 76. Lochia alba follows Lochia cerosa and usually lasts from the first to third week pp. What is Lochia? A. Brown to red, contains decidual cells and leukocytes. B. Creamy white brown, contains decidual cells, may have stale odor. C. Brown to red, tissue fragments, odor. D. Creamy white brown, stale odor. Correct answer B. Creamy white brown, contains decidual cells, may have stale odor. 77. One function of parasympathetic nervous system is A. Stimulating of sweat gland. B. Constriction of pupil. C. Contraction of hair muscles. D. Acceleration of heartbeat. Correct answer B. Constriction of pupil. 78. Using precise methods to investigate problems and arrive at solutions is called A. Scientific problem solving. B. Critical thinking. C. Trial and error. D. Planning and execution. Correct answer A. Scientific problem solving. 79. A 22-year-old Megha comes to the doctor because of a missed menstrual period. She has hypothyroidism for which she takes thyroxine. She has an artificial heart valve for which she takes Coumadin, and she recently started tetracycline for acne. Urine human chorionic gonadotropin is positive. Which of the following medication should the patient continue to take during pregnancy? A. Tetracycline. B. Coumadin. C. Thyroxine. D. Oral contraceptive pill OCP. Correct answer C. Thyroxine. 80. The junction at which an impulse travels from one neuron to another is called as A. Stimulus. B. Nerve message. C. Synapse. D. Axon. करेक्ट आंसर सी, साइनैप्स। कैसी लगी यह वीडियो कमेंट करके बताएं। अगर अच्छी लगी तो अपनी दोस्तों के साथ शेयर करना। एंड डोंट फॉरगेट टू सब्सक्राइब। थैंक्स फॉर वॉचिंग। सी यू इन नेक्स्ट वीडियोज।